Welcome back to Fox 26 Morning News. Here's a stretch of the roadways. It's looking a lot better at this hour. You're looking at I-10 East at Federal through this Houston TransStar camera, but it is wet out there. I hope you'll be safe and slow on those roadways if you have to get out today. Well, about 90% of women will get stretch marks during pregnancy. Sometimes they go away on their own, but often they do stick around forever. I asked Dr. Derek Liu with Renew Body Contouring how he's helping women wipe them out. Our viewer Sheila says she has a quote-unquote mommy tummy from having 3 babies, and she wants to tighten up the skin and also minimize stretch marks. She wants to know if you might have some ideas for her.
Absolutely. We see this situation very commonly in our practice, and we do have some treatments that do work very well for it. We start off with the situation with the mommy tummy is usually a factor of stretching of the skin and some stretch marks that do occur with pregnancy.
And you have an example here of
Absolutely.
A treatment that you're working on.
This patient here we've treated. She had severe stretch marks before. She's undergone several treatments already with both our Fractora radiofrequency resurfacing, our Fractora firming and skin tightening regimen, and also our Tight Effects system, which kills fat cells and also tightens the skin as well. The radiofrequency technology that we use here is very effective, and as you can see, compared to our before photos, has actually caused quite a bit of improvement in the way that she looks.
And so it helps most patients who have stretch marks?
Absolutely, absolutely.
Well, now, what about tightening of the skin? Because sometimes that's a completely different deal.
In terms of tightening the skin, it's just a matter of delivering enough energy with our radio frequency devices to cause enough reconstruction of the skin or rejuvenation of the skin. And that's accomplished through all of our radio frequency devices, both through the firming and through our body tightening technologies.
And with this particular viewer, we're talking about having 3 children. Are you able to ever tighten that up well enough on your own with diet and exercise?
It gets to a point where, I mean, diet and exercise is always recommended, of course. It does take some time to get there, but and there are situations where, you know, enough of what you can do on your own is just not going to quite get it to where you want to be. So doing non-invasive and sometimes surgical interventions are necessary.
Okay, thanks for your help.
All right, no problem.
If you have a question to ask the doctor, you can reach out to me on Facebook at Melissa Wilson Fox 26 or on Twitter at Melissa Fox 26.